Welcome back to the podcast Heal Without Harm. My name is Dr. Clayton Dir, physical therapist and the one bringing you the truth about the medical system. Today's podcast is going to be about osteoporosis and a little bit more specifically the post-menopausal woman. I know, super exciting. The things that I want to cover is that I've noticed a lot of people, women specifically, believe that getting older and getting more frail is just inevitable. They think it is unchangeable. They think getting osteoporosis and going on a pharmaceutical medication to stop the osteoporosis is just part of life. And it isn't, or at least it doesn't have to be. The downside with a lot of those medications is they actually create more frailty. They create brittle bones. They have a lot of side effects. Today's podcast is going to cover what you can do under supervision based off the study, but what you can do to take osteoporosis into your own hands and reduce falls, increase strength, and actually increase bone density. I'm going to start with telling you a little bit of a story of a patient of mine that actually blew her surgeon away, and the fact of how well she improved her bone density, and then some specific takeaways on what you can do even as early as tomorrow to start reversing the loss of bone density. So I had a patient, one of my favorites, that came in, and she had started developing knee pain when going up the stairs. About that time, she thought, well, I wonder if I just strengthen my knees, if that'll make the pain go away. So she started weightlifting for the first time in her life at the age of 58 years old. Within 2 to 4 years, she had started powerlifting, and she even started to compete as a powerlifter. Again, she did not start weightlifting until the age of 58. After about 5 to 7 years of weightlifting, she had a follow-up at one point in time with one of her doctors. I believe it was her surgeon. And when they did the DEXA scan, the scan for bone density, which some DEXA scans, they'll scan the whole body. Some of them, they'll get very specific and only check the femoral neck, which is the thigh bone and the hip, or they'll only check the lumbar spine, or a mix of those. And when they checked it, she had actually improved her bone density significantly. And the doctor was very much surprised and said, "What are you doing? I've never seen someone's bone density improve by this much." Lo and behold, she was weightlifting. She was lifting weights. The thing that a lot of people thought was not safe to do, it's actually what reversed her osteoporosis and osteopenia. So that's what I want to get into, is you don't need to become a powerlifter though. They've done studies on figuring out what is the minimal effective dosage. What is the least amount you have to do to get at least some, if not a lot of the benefits. So that's what I want to get into. There's a study done called the LIFTMOR Protocol. Specifically, it was done in 2018, or at least the one that I'm going to be referencing. That what they did is they took, let me read it here. I want to make sure I get specific, okay? So they had 101 post-menopausal women who already had low bone mass, a T-score less than 1.0, if you know what that means. And they were randomly divided into two groups. One of them, high-intensity resistance training. Don't be intimidated by that. The other one, low-intensity control group. So think about your classic bodyweight stuff. Both groups trained 2 times a week for 30 minutes over an 8-month period. Again, 2 times per week, 30 minutes each, 1 hour total per week for 8 months. They measured bone density via the DEXA scan before and after. And I want to get into the specifics. So on the low-intensity group, tell me, well, you can think to yourself if you've done this type of workout before. The low-intensity group followed a home-based, unsupervised program, so they did it by themselves at home, under 60% of their 1-rep max. A 1-rep max is how much weight you can lift one time and not be able to lift it a second time. 1 repetition max. So they were lifting under 60% of that with 10 to 15 reps. So they're doing 10 to 15 reps of each of these exercises: walking, lunges, calf raises, light resistance bands, and stretching. They didn't progress any higher than a 3 kilogram hand weight by month 8. 3 kilograms is about 6.5 pounds. So they were either doing body weight or 6.5 pounds or less. Again, very lightweight. The high intensity, again, don't be intimidated by that necessarily. The high intensity took about 2 months to learn the different movements, which included deadlift, back squat, overhead press, and jumping chin-ups with drop landings so that they would have some sort of impact into the body. They took about 2 months doing each of the exercises and training in the movement patterns for safety before they went into the high intensity loads. They trained 5 sets of 5 per exercise at about 80 to 85% of their 1 rep max. So if they figured out that they could do 100 pounds for their 1 rep max, they were lifting weights at about 80 to 85 pounds for 5 sets of 5. That still only took about 30 minutes, and they did that twice a week. So 1 hour of training per week for 8 months. That is what the study did. What they found is the lumbar spine, so the low back, they had about a 4% greater improvement of bone density compared to the control. The femoral neck, they had about a 2% greater improvement compared to the low intensity. They found on their functional performance, such as their balance, strength, and mobility, they had significant improvements. On the timed up and go test, which tests for fall risk, they improved on that, so they had a much less fall risk. The 5 times sit to stand, so just going from sitting to standing 5 times, they improved that, so they had better lower body function, and there was no serious injuries, showing that the protocol is deemed safe. So it's a very simple protocol, and they did recommend having supervision. Of course, you want to make sure you're lifting correctly and lifting safely, and you have spotters as needed. But the big thing here is they've actually found that at a 1 hour a week, you can actually start to improve your bone density post-menopausal specifically. So why are more doctors not prescribing this? I actually don't know. I don't know why more doctors are not recommending this to people. Instead, they put you on Fosamax or whatever the other medications are with a bunch of side effects that are causing all these other issues alongside, and they don't even necessarily significantly help. Where you start weightlifting, so you have your doctor instead recommend, hey, I want you to go to a physical therapist. There's this thing called the LIFTMOR Protocol. I want them to teach you how to weightlift, make sure you're doing it safely, and then I want you to start lifting weights so that you can build muscle mass, you can reduce fall risk, you can reduce balance issues, and you can increase your mobility, you can increase your bone density and strength, and all of these things. That's what you could have if you start doing this. Why would they not recommend that? I don't know, but I am. So if you have a male or female in your life, at any age, honestly, but if you have this post-menopausal lady in your life that you're like, hey, this could be life-changing, she should lift weights, please send this podcast to them and let them know that the research exists on this. And there's physical therapists out there that would love for someone to show up, not even in pain, just having low bone density and saying, hey, I heard of this thing called the LIFTMOR Protocol. Can you please teach me how to lift weights so that I can get strong and get better balance and decrease my fall risk and increase my bone density? You would make a physical therapist's day. So that is what it looks like. You get warmed up and then you do 5 sets of 5 on back squat, 5 sets of 5 on overhead press, 5 sets of 5 on jumping chin-ups, which specifically on these jumping chin-ups. So imagine you're standing at a pull-up bar. You're standing flat-footed, you reach up and you can grab the pull-up bar still flat-footed. You actually jump while you pull. So you're jumping into the pull-up so you can get your chin over the bar. And when you come down, you make sure you land back on your feet with a pretty good like thud sound. And that thud sound is impact getting kind of jolted through your body. Again, making sure you're doing it safely. But that jolt through the body is what increases the impact load on your bones. And that specifically is what signals the brain to increase the density of the bones and build them to be stronger, specifically. And that's it. You just repeat this twice a week twice a week. And over an 8-month period, you listen to the numbers. 4% improvement in the lumbar spine, 2% greater improvement on the femoral neck in regards to bone density. I had some questions here that I wanted to make sure I answer. So another question that I had, for a woman in her 50s or 60s who has been told that she has osteopenia or osteoporosis, what should she be actually doing and what should she be asking her doctor or physical therapist? The goal of what she should be asking for is there a more natural way to improve my bone density with like naturally? And the answer would be yes. You can make sure you're eating enough protein, getting enough sleep, getting enough water, making sure you're lifting weights to demand strength gains on the muscles, doing some sort of small to great impact, depending on where you're at, to start strengthening your bones, just like you can strengthen your muscles and reverse the osteoporosis or osteopenia. The last question I want to answer, and then we're going to finish out because I wanted to have this podcast about 10 to 12 minutes just to expose you to this information. And if you have further questions, I will put all my contact information in the description below so that you can reach out to me. The last question, what's the biggest mistake I see people make when it comes to bone health and exercise? And what would you tell someone who is scared to lift heavy because of their diagnosis? This is something that still is between you and your doctor in regards to the relationship, because I know nothing about you, the one listening. But what I would recommend is you find a provider who their goals align with your goals, and that is getting back to having strong bones and strong muscles naturally with the least amount of pharmaceutical intervention, because that generally has side effects come along with it. The most common mistake I see is that as we get older, we start to live a life where we want to be more protected, and we want to almost live as if we are increasingly frail or increasingly fragile. And when we treat ourselves that way, we unfortunately create our own fragility to an extent. As we get older, we think, oh, let's not carry that because it's heavy. It's like, or we can continue to train to have the strength to carry that. Let's not do that because I don't want to fall. It's like, well, then let's train so that we have better balance so that we don't fall. As our bones start to become less dense or more breakable, we start to do less things that could break our bones, as opposed to finding small ways that we can actually improve our bone density so that if we were to fall, or if we were to trip, or if we were to do something that could break our bones are actually strong enough to handle that force. That's the way I would look at it. Is we look too much at ourselves or at our loved ones as they get older as somebody who is frail and needs assistance and need everything done for them, as opposed to somebody who needs to be empowered and told they are strong and they can do it. Here's the bottom lines. Here's the bottom line. There's just one, okay? There's just one bottom line, not multiple. Your bones respond to stress. Heavy, progressive loads, heavy relative to you, your heavy and my heavy could be different. But heavy, progressive loading is one of the most powerful signals you can send to your body to build bone density. Your body just simply responds to the stresses placed upon it. And the research completely backs this up. If you or someone you love has been told that they have osteoporosis or osteopenia, please do not let fear of lifting hold you or them back. Find a qualified professional, generally going to be a physical therapist, get supervised and instructed on how to do it, and start loading up the muscles, loading up the joints, and loading up the bones. Your future self will thank you, or the person you're sending this to will thank you. And if you found this episode helpful, please share it with someone who you know needs to hear it. Please send it to them right now. Or share it to your story and say, for anybody out there who has low bone density, check this out, and then tag me at the doctor on all the socials: YouTube, Facebook, Instagram, TikTok, whatever it may be. Please share it, tag them, and if you have any questions, my contact info is in the description below. I hope you guys have a good day, and I hope you learned how to heal without harm.